This afternoon, they're both going to be providing updates and help answer any questions that you may have. And also, Dr. Rustin and Dr. Peacock have been touring around with Dr. Toomey and I this afternoon, looking at some great things that are going on. So we're glad to have them with us and appreciate all of their continued hard work. To begin with, I just want to let you know we continue to make significant progress in vaccinating Georgia's most vulnerable population, that is our seniors. As of today, 1,040,000 seniors have received at least one dose of the vaccine. That's 74% of Georgia's seniors, according to the American Community Survey census data. Almost 3/4 of Georgia seniors have a significant amount of protection against COVID-19 with at least one vaccine dose. In all, we have administered 81% of the state's allocated doses at over 3.2 million doses total. I'd also like to ask the media outlets that are here today and those that are following this to include in their reporting that according to the CDC website, Georgia has been shipped the second fewest number of doses per 100,000 residents out of all 50 states. We must always do better in getting shots into arms, there's no doubt about that. But we are also 49th out of 50 states in vaccines shipped to us by the federal government per 100,000 residents. So when Dr. Toomey and I continue to say we have supply issues as a whole state, the CDC's own data proves that point. This context is absolutely vital when informing the public of how Georgia is distributing its vaccine. I also would remind the media here today that we continue to work through data reporting issues that is shorting Georgia at least 250,000 doses confirmed as administered through the federal pharmacy program that have not been reported as administered in our state. As far as vaccine eligibility, Dr. Toomey and I have been clear from the beginning that when supply was limited, we would prioritize the most vulnerable, and that's exactly what we have done. And today, 3/4 of our seniors have significant protection against COVID-19. We were also consistent that as supply increased and we vaccinated more and more high-risk Georgians, the state would move to expand eligibility. This week, Georgia received over 450,000 vaccines. That includes both first and second doses. While we do not have a specific number yet, we've been told to expect an increase of both Pfizer and Johnson & Johnson next week. And due to the uneven demand public health officials and private providers are experiencing in different regions of the state, the Department of Public Health directed approximately 70% of this week's total vaccine allotment to the North Georgia and Metro Atlanta area to put more supply where the demand is highest. While overall demand is greater in the Metro Atlanta area, we also have sites like the Mercedes-Benz Stadium that we toured today that have appointments available and open for next week. In much of rural Georgia, south of Macon, the demand is much lower. However, our Habersham County site in northeast Georgia is booked solid for the rest of the week. In Savannah, Director Stallings and the GEMA team moved that site to a walk-up optional site, and instead of roughly 200 appointments, over 800 vaccinations were completed in one day. This is just one example of how the state continues to adapt to changing circumstances on the ground, and we're encouraging private providers to do the same. Providers should partner with local churches, civic groups, and community organizations to get the word out about vaccine availability, and everyone should be utilizing 80% of their doses received within 7 days. We cannot afford to have vaccines sitting in the freezers, whether it's in Metro Atlanta or rural Georgia. If you are currently eligible for vaccination, please make your appointment. If none are available today or tomorrow, go ahead and make an appointment for next week or 2 weeks down the road, whatever the case may be, and confirm your spot in line as quick as possible. The resources remain the same. Local public health districts are ready to assist you, and you can schedule those appointments at dph.georgia.gov, or you can sign up at one of our 8 state-operated mass vaccination sites at myvaccinegeorgia.com. You can also check with your local providers like Walmart, Walgreens, CVS, Ingles, Kroger, Publix, and your local hometown pharmacy. Again, please make those appointments today or tomorrow, even if you're scheduling the vaccination for next week or into the future. As Dr. Toomey and I mentioned multiple times over the last few weeks, we would be moving quickly to expand vaccine criteria provided we continue to see increased supply from the federal government. That's why, effective this Thursday, March 25th, all Georgians over the age of 16 will be eligible for the COVID-19 vaccination. Once that expanded eligibility goes live on Thursday, appointments will no doubt be hard to find in certain regions of our state. We will continue to shift doses to the areas of highest demand as we have over the last few weeks. That is why we prioritized our seniors for 2 months. Once the most vulnerable Georgians had every opportunity to be vaccinated and supply increase, we would have to expand eligibility quickly in order to ensure every dose available to us is administered quickly. As many of you saw, our First Lady, who joins us today, got her vaccine last week. I'll be getting my shot this Friday down in Waycross to help encourage all Georgians to take advantage of this medical miracle of modern science. I also just saw on social media where our Chief Justice Harold Melton, Justice McMillan, and much of the court staff was vaccinated today, and we appreciate them showing leadership in that area. As you all know, this is our ticket back to normal, and we're getting closer to that point every single day. So again, I want to encourage you to go ahead and sign up today and be ready for the expanded eligibility on Thursday. With that, I'm going to turn it over to Dr. Toomey, and she'll be providing an update for you.
Thank you very much. I wanted just to give you a few updates on where we are in terms of our numbers, but also what we're doing to reach some of the most vulnerable in our state. In addition to these mass vaccination sites that are reaching many, many people, there's still many who may not be able to come to those sites, and I just wanted to highlight some of those as well. Our numbers are still looking very, very good. Positivity is average for the last 7 days, 5.4%, and we can hope that that can continue to stay low and will get lower. Hospitalizations and deaths are down to about 40% over the last 14 days, which is a very, very good statistic. And overall, our outbreaks have decreased considerably. And now we're seeing outbreaks in schools, outbreaks in workplaces, and once again, as I noted last time we were here, long-term care facilities are no longer a site for outbreaks as they used to be, and that has continued. And that is, as we've said before, is what we're hoping will be the goal for the state as a whole, as we all strive to be vaccinated throughout the state. We have been identifying additional variants, though. I do want to raise that issue because the variants add a little twist to this because of they are easier to transmit, and some of them may be a little bit less susceptible to protection by the vaccine. We've had 365 confirmed cases of COVID variants. Most of those, 351, have been of the UK variant, 15 of the South African variant, and one of a newly reported Brazilian variant. And that variant from Brazil may have, again, a little more difficult clinical course. We're staying on top of this very, very closely. This is where contact tracing is absolutely essential because our 1,500 contact tracers are being fully deployed to follow up cases, particularly when they're in vulnerable populations, but also all these variants will be followed up very, very closely. And we will continue to report on this as we move forward. This only again reinforces the fact that it's incredibly essential until we get more individuals vaccinated throughout Georgia to continue to follow those basic guidelines of wearing a mask when you're out in public, try to avoid big gatherings, washing your hands, and most of all, please encourage everyone to be vaccinated. All 3 of these vaccines are safe, they're effective, and they will be our key to allowing us to open Georgia as a state and enjoy those freedoms we so are missing at this time. I did want to just point out that we have some incredibly important partnerships that we've been using, special partnerships to address adults with intellectual and developmental disabilities. We had a special clinic in Marietta earlier this week and are partnering to increase vaccinations at 4 pilot sites, 1 that opened up today in Athens, and 3 more in the next week in Thomasville, Lawrenceville, and DeKalb. This is a special collaboration that we've developed with local Walgreens to provide a safe and an easier site for these individuals to come who may be a little afraid to come into other places or may be uncomfortable to come into other places. Several hundred people in this population group has signed up to come to these sites. And so I want to make a pitch. I haven't done this before to you, but I want to make a pitch. If you want to write a really good story about some really good things being done in our state, it's through these partnerships to reach some of these hard-to-reach populations that are really very special. Right now, Dr. Peacock isn't here with us, but is actually in the adjoining room on a call at the request of the Association of State and Territorial Health Officials to talk to other states and project areas about these partnerships, both for the intellectually disabled, but also for homebound individuals. We have about 3,000 individuals we'll be serving in our partnerships for those who can't come to vaccination sites because they're at home, and also through some of our other work with the intellectually and developmentally disabled collaborations. I also want to say that we've made special efforts to reach those who may not be able to hear and receive their messages through the radio or television, and really want to thank David and his colleagues for their help in making videos that are now available on the website so that everyone can watch these videos and get the information they need to know how to be vaccinated and to stay safe at this time and protect themselves. And so that's kind of where I wanted to end up, but I really wanted to thank you all for the opportunity to, again, say we're doing some really great things, and I'd like to do a shout out to our public health staff who have made these collaborations happen. Thank you.
Well, thank you, Dr. Toomey. That's great news about the work you're doing with those that are very vulnerable. Now, Director Chris Stallings, the Georgia Emergency Management and Homeland Security Agency, will give you an update.
Thank you, Governor, First Lady, Dr. Toomey. Good afternoon. As we continue our vaccination efforts across the state at our mass vaccination sites, we're working with our partners to ensure a smooth and easy process. As of 3 p.m. today, 104,846 Georgians have received vaccinations at one of our mass vac sites. Our team is working extremely hard with the National Guard, Georgia Department of Public Health, Georgia DOT, and all our public and private partners as we continue to put vaccinations in people's arms. From the beginning, we knew that myvaccinegeorgia.com would be a very critical piece to our vaccination process. We've worked diligently with our vendor to ensure that the site was user-friendly and as intuitive as possible. But we are aware that there are some issues that the public has had scheduling second doses at myvaccinegeorgia.com, and I want to address some of those. Beginning today, we've added staff to all our existing sites that will be scheduling second dose appointments on site. Before you leave the observation lot, you will know the date and time of your next appointment. And that is critical to peace of mind for our folks, and we understand that. And we apologize that at this moment, it has not been that simple. We've identified an issue that folks who were registered for their first dose while on site haven't received a follow-up email. What happened was you showed up without an appointment, or there was a problem with your appointment process. So if we registered you on site, for some reason the system did not recognize you as a new appointment. There are a little over 23,000 people who fell into that category. As of this afternoon, we're hoping that we will have an announcement for every single person to have received an email. We're working through that list, so we apologize for any delay. If for some reason you are coming up after the 21st day, you can't come before the 21st day for Pfizer, but if you're coming up after the 21st day and you've not yet received an appointment, come on to the site that you received your vaccine at, and we'll take care of you. We don't want you concerned. We don't want you bothered. It is important for those awaiting the second dose to understand, to make this the efficient process we want it to be, you need an appointment. There's still been some confusion that we want to clear up as well. And Dr. Toomey and her team have confirmed that the earliest you can get a Pfizer vaccine second dose is 21 days, but you have up to 42 days to get that second dose. So don't panic if you're not getting it on the 21st day. Give it time. We will get you in there before that 42nd day. Another issue we're seeing is that people are mistakenly believe that the date on the back of your CDC vaccination card is your appointment date. It is not. It is in fact the earliest you can return to receive your vaccine. So don't think that's your appointment date. That's the earliest you can return. We want to thank the public for your patience as we work through this process. We'd also like to thank you for the positive responses that we've gotten. There's not a day that goes by we don't get an expression of gratitude and appreciation for what our sites or what Dr. Toomey and her team at the public health sites are doing, and we do thank you for that. We thank you for your patience. It's been an extraordinary effort on the part of our staff as we get to continue to work together to ensure that we move toward the goals of getting every Georgian vaccinated. Thank you again, and again, we appreciate your patience as we work through this together.
All right, we'll open it up for questions. John?
Governor Kemp, now that you're opening this to all adults in Georgia, not just the most vulnerable, which has been the focus, can you say that Georgia will now soon approach 100% of available supply actually being administered, and how important is that to you?
Well, I mean, it's going to be virtually impossible to get 100% of the doses, because we have to hold certain doses we're getting to make sure we got enough second doses. We're always getting, as we've said many times, and I think this confuses a lot of people, but when those doses are being shipped to the state, we're counted as their ours, and we haven't received them yet. So we can't give a shot in the arm with the dose that we haven't physically put our hands on. Once we do get our hands on them, we have to logistically move them around, which I talked a little bit about today, of moving the vaccine to where the demand is. We've been doing that very well the last couple of weeks. I think it's been very effective. I think our private sector partners and other providers have done a really good job of getting the message that you don't need to be holding doses. The supply, we have been assured by the federal government that the supply is steady, it's increasing. We're going to have the doses for second doses. You don't need to hold, you need to go ahead and use 80% of your first doses and just coordinate that out. And I think people are doing a lot better job of that. So I don't know that we're ever going to give away 100% of our doses. We're also starting to see, really with the high levels of the senior population that we have vaccinated, we're starting to see that demand start to flatten out, which makes sense because we've done so many of them, and that's who we were targeting. And I think it shows that, our approach to protect the most vulnerable, to drive our hospitalizations down, to solve the problem we had in our nursing homes and other facilities, and really protect those that raised us and raised our parents has been working. But we're also seeing, less demand in our rural areas. So we're expanding eligibility to make sure we continue to keep the demand as high as we can, even though it may take a little bit longer in the metro area because of that demand. It will hopefully help us continue to get shots in arms with the supply that we do have in our rural areas. But we're going to continue shipping doses where they're being used. So if they're used in the metro area, that's where we're sending them. It doesn't matter if it's Columbus, Atlanta, Augusta, Gwinnett, Cobb, Clayton, whatever it is, we're going to send them there and keep getting shots in arms. I just want to encourage everybody to get the vaccine. I mean, there's no doubt that, especially, we're seeing this across the country, but especially in the South, we're seeing vaccine hesitancy. That is concerning. People should not be hesitant. This is a medical miracle. It's safe. It's effective. We have a lot of great leaders like our First Lady, our Chief Justice. I talked to Champ Bailey earlier today, great Georgia Bulldog, NFL Hall of Famer. He's promoting getting the vaccine, and we need to do that. It is our ticket. It is our ticket back to normal, to what we want to get to in the days ahead.
And having said that, how important it is for you to see the state make some sort of aggressive education campaign in Southwest Georgia, for example. A year ago, it was enduring one of the worst health crises ever in our state. And
look, we are doing that literally every single day. I mean, everywhere Dr. Toomey and I have been, we have been talking. I don't know how long we've been talking about vaccine hesitancy. It's been a long time. And we're going to continue to do that. That's one reason I'm waiting. I mean, I've been wanting to get the vaccine for over a week now, and I've been waiting because I wanted to get to South Georgia where we're seeing that hesitancy to try to help with that problem with the demographic that we're dealing with down there. But we have a lot of other great leaders like we saw it. I've talked about St. Philip AME Church, the partnership that they had with Walgreens to go directly into the church to administer vaccines. We saw the same thing with African American pastors that are doing great work in the Augusta community. And it is now that time. That's why I said today, our providers need to start thinking outside the box. We're doing that. I talked to our team today about, expanding this eligibility. Once we work through this early rush that we expect that we'll see, especially in the Atlanta area, we got to get mobile. We got to encourage our providers to get mobile where we can go to the neighborhood, we can go to the churches, we can go to the civic clubs. We're working on partnerships with private sector companies that have large employment bases in one location to try to see how we can work with them. I met with a group from Athens the other day that's talking about doing a mobile program. We got some numbers back from them today. I think you're going to start seeing a lot of that, especially since we have the Johnson & Johnson one-dose option now, because it makes that a lot easier. You go into a neighborhood, into a church, you're one and done. You're not having to schedule second appointments and come back. We can do that, but logistically it's easier if we don't have to.
Hey, Governor, on that same theme, can you elaborate on efforts to increase the vaccine supply in Metro Atlanta where it seems tightest? Your office's advice a couple days ago is to encourage Metro Atlantans who couldn't get the vaccine to go elsewhere. Is that still the advice?
Well, and my point that I was making about going elsewhere, obviously not everybody can do that. We had an individual from Gwinnett that showed up at a Savannah hospice provider because they had a disabled child that was really concerned about taking shots. They wanted to get Johnson & Johnson. That's where they found the dose, and it was worth it to them to drive 3.5, 4 hours to go get the shot. Not everybody can do that. But there are appointments available in rural parts of our state. So I would encourage you to look for appointments in the Atlanta. If you're in the metro area where the demand is still very high, we have great options. We got the federal site that I toured today at Mercedes-Benz. It's going to be incredible. It's an awesome partnership with FEMA, GEMA, Public Health, Fulton County, just private sector with Steve Cannon and Arthur Blank's team letting us use the stadium, their resources. They have a lot of bandwidth there that's not taken away from our site supply. We have our normal sites. You have Fulton County Public Health. You got the private providers. But like if you're desperate to get a vaccine now and there's not an appointment, the rest of this week, if you're willing to drive an hour, you may be able to find health departments outside of the metro area that have availability. There certainly are those south of the Nat line. We know that for sure. But that's why we're continuing to send 70% of the doses to where the demand is. And I think that's going to continue to help our numbers, and we'll just keep sending them where they need to go, where we can get every shot in every arm of somebody that wants to get it. And you know, we got to continue to work in message too. All our leaders do across all sectors of everyone needs to get vaccinated.
Governor, have you set a goal in terms of percentage of Georgians to be vaccinated by a certain time, whether it's the end of the summer or fall? Do you have a number in mind where we need to be? Is it 50%? Is it 70%?
Well, I wouldn't even know what to tell you that number is going to be. We're seeing hesitancy, and I hope that as the longer it goes, the less people we're going to see be hesitant, with more and more people getting it, more and more people getting comfortable, more and more people getting past the 2 weeks or 30 days since they had their last dose, whether it's a 1 or a 2 shot dose. I mean, I'm not going to try to speculate on what that number is. We are going to make this vaccine available to all parts of our state, as we have done, even though some places, unfortunately, the demand was not there. We had it there for people to get, but now we are at the point we're going to continue to change and move quickly. We're going to move the doses to where the demand is, and if that demand ever weakens, then we'll try to figure out something else. But I think the next part of this is really going to be more localized than a federal or state, push down. I mean, we need, like we've seen in other areas, we need your local doctor, your local pharmacist, your local pastor, your local faith leader to encourage, their flock and their patients to get the vaccine. We need to be working with our private sector providers to get their employees where they have access to the vaccine. That will be our next step to really, get to every available person to give them the opportunity. Now, whether they take advantage of the opportunity, I don't know, but we want to give it to them, and I would encourage them to do that. But there's going to be a point also where we're not going to wait around anymore for that. We want to make it available, but we can't hold others back because of people's vaccine hesitancy.
Governor, we had this question come into the station about homebound seniors. Obviously, you have 3/4 of seniors being vaccinated, but some are staying at home with their families. What's being done to try and get the vaccine to them, and what can their caregivers do to get the vaccines?
You want to talk about that, Dr. Tim?
As I mentioned, we have a special partnership developed to reach those individuals, and we've identified at least 3,000 homebound individuals statewide. Our director of nursing is working with both local public health as well as other providers who are able to go into do home visitations and do the vaccines in homes. And we have identified individuals through a number of ways, through the AAAs, the areas on aging, and as well as Meals on Wheels, and through other organizations who reach the homebound. And so we have identified those, assigned them to providers, and are working in that now. And as I said, it's over 3,000 throughout the state.
And I'll just follow up, too, on that. I referenced this earlier, but the group from Athens that we were talking to earlier this week that was brought into office by Representative Spencer Fry, that is exactly what they're going to be doing. They want to go mobile. They're talking about getting, 50 or 100 doses and going out into neighborhoods and working in these communities that people either don't know, can't get signed up, don't have transportation, but taking the vaccine to them. And I think we're setting something else up with another person that's working with a lot of our homeless population into how they can get a vaccine clinic, whether mobile or in a lot of those areas, to try to tackle some of that as well. So it's going to have to get very granular here towards the end.
Hi, good afternoon. I have a question about the vaccine dashboard. Currently, it's still dividing things up by first dose and second dose. How are we reflecting the Johnson & Johnson vaccines, or are those currently included in dose 1? Are those going to be broken out at some point for more transparency?
You want to speak to that?
It will be broken out separately. It'd be too confusing. It would look like people are getting one dose and then not getting their second dose. It'll be broken out separately. And if we get AstraZeneca or some other vaccine, that will be added as well.
Do you have a timeline?
Not yet. It's still being studied.
All right. Well, thank you, everybody.
Governor Brian Kemp announcing that as of Thursday, all Georgians 16 and over will become eligible for COVID vaccines here in the state. The governor with a wide-ranging update talking about the vaccine effort here and his attempt to get as many Georgians as possible vaccinated. The governor saying that vaccine hesitancy remains a problem, but he said it shouldn't be a problem. That this is a modern miracle. He called it our ticket back to normalcy. And he said that he hopes that as time goes on and people see and they know of friends and family that have gotten vaccinated and are doing okay, that may alleviate some of the vaccine hesitancy that we're still seeing. But again, as of Thursday, Sean, and this is a big deal because Georgia will become only the third state in the entire country to offer COVID-19 vaccines to all residents 16 and over.
We currently rank 49th out of the 50 states, but the governor seemed really optimistic that now that he has expanded COVID-19 vaccines eligibility, that this will dramatically improve Georgia's standings. Right now, according to the governor, the overall demand for those who are wanting vaccines in Metro Atlanta is the greatest when you compare it to all of the other counties surrounding Metro Atlanta. But there are appointments still available at Mercedes-Benz Stadium. The governor is encouraging those, despite your vaccine hesitancy, to please get the vaccine. It is really, how he put it, a miracle, and could be what could turn the curve for us to go back and resume to normalcy. We are continuing to follow this story throughout our newscasts at 4, 5, and 6, also on our multi-streaming platforms, including CBS46.com. We're going to take a break and we'll be right back.